Okay. All right, so I'm gonna go ahead and get this meeting started, calling and get to order. Kay is not available today. Again, with issues at home that she's having to deal with that are pressing. So I'm standing in for her. Chief Chavis, you're on the phone.
Oh, yes, I'm here finally. Thank you. Hello.
Okay, and then Patricia from Minority Affairs is with us too.
Yes, ma'am.
Since there's just the three of us, I sent out the meeting notes from the last meeting. I would share the screen, but there's really, I don't know. Chief Chavis, did you get that? The minutes?
That's right. We did.
Okay. Normally what we would do at this point is adopt those minutes. I'll go over them real quick.
Can I make a motion to accept them?
Sure. Let me go over them real quick. Brenton Brown was going to double check with Dr. DeCosta, see if the letter to be issued by Minority Affairs was approved. It was, and it was emailed last Thursday. We're running this health survey through the end of September, keeping the survey for the 2023 data, and going to start, I'm sorry, I said September, run the current survey through the end of October. And then start with new numbers November. So we'll be starting to collect the 2023 numbers in November, or the data from 2023. The health profile, we said it should include health issues and contributing factors. Leave report broad to statewide instead of by tribal entity, but later if we decide that we have enough information or the tribe wants it, we can break it down. I was going to reach out to Dr. Fenton for guidance on data to see if he had any information already. I'm sure he does because he does for Orangeburg. I didn't get to do that yet. I was sick with COVID the whole week and a half after this meeting. I will get in touch with him. Dr. Cavallini reported that the Rotary Club was excited to put the health survey out in their communities, outreach in hard reach communities. We learned from experience with COVID outreach that in the low country region, there were pocket communities that are not easily accessible. Examples overcoming that was the Yamasi and Allendale going door to door. The Beaver Creek, we're hosting an ice cream gathering, which was yesterday. Brenton did send us the information for the flu shot. I'm waiting to know when it'll be available in across the state.
I know that, sorry, I know that the flu, I just got my flu shot, so this is the only reason I know it, but I got mine here in Columbia at like Publix, so.
Okay, so they already have. That's
yes,
good.
ma'am.
The Stay in Your Lane contest, art contest is, the flyer is out. I think with the art contest, Patricia, I think we were trying to find out if you could put it in the next newsletter.
From my understanding, Miss Cherie said yes, it could be posted, and I believe she already posted it online. And
Okay.
Andrea said that she could put it in the newsletter, the next newsletter. Yes, ma'am.
Okay, and then we said the next meeting was today. So Louie's already made a motion to accept the minutes. Can I have a second?
I second it.
Okay. And shooting off from the minutes, we'll just go back over real quick so we can get it in the current minutes. The flu shot apparently is available in certain places. We can look and see if DHEC has a distribution or a locator like they do for the COVID vaccine, and post that on the Facebook page for Pine Hill Health Network. I'm sure Minority Affairs will post it as well. August is National Breastfeeding Month, and we are still promoting that at powwows. Louis, your gathering yesterday, I know we talked earlier. How did your gathering go?
Well, we took and spent about a good 25, if not 30 minutes, okay, talking about what the Pine Hill Health Network is trying to do. There seems to be great interest of my people. Not the first one, okay, had any ill thoughts or complaints, okay? None. So, you got to carry it forward. You just can't stop now, okay?
Right. And I appreciate that. And I do apologize that we were not able to come yesterday like we planned to do.
No. You done us a favor, okay? With COVID, oh, Lord, no, stay the heck away, huh?
COVID has been pretty rampant around us. It's finally come into this community. And like I said, I was sick with it for a week and a half. And I know the reason that we made the decision not to go was, one, COVID has spiked so much around us here in this area, but also because the community health workers that were planning to come are also caretakers for cancer patients and cannot be exposed at all. Their cancer patient has no immune system due to chemotherapy and radiation. So out of precaution for everybody, we skipped that. We'll definitely try to make the next event that y'all have. Do you have an idea when the next event might be?
Talking to me?
Yes, sir. Y'all do something in November, don't you?
I'm going to just be honest with you, okay? We won't meet again, okay, until October, but October is our tribal gathering for the year. How much time would you need to discuss what that you want if you could come to our gathering on the third Saturday of October?
It probably wouldn't take us 15 minutes to go over, the overall of Pine Hill Health Network, what programs we offer, and then we can do the health fair forms for whoever might be interested in
Well,
that.
wait a minute. You think you could be available on the 15th of October and meet with, there'll be people here from all across the state, I reckon, okay? All of them, okay, will be indigenous. Could I ask, okay, to go out of your way and be there with us on a Saturday?
Sure. We'll do everything we can to make that.
See, I don't want to take and put anybody in the bind, but see, on into December, I promise you, Sandy's going to be there. You with me?
Right.
No, see, we had him one year come in, okay, from the Bahamas, okay, with all the beads and all in his hair and his beard. Oh, that was an ugly sight, okay, but would you like to try and make it October?
We can definitely try to make it October the 15th. I'll make sure and let
October 15th. We're going to try and get it started about 10 o'clock in the morning. What would be a good time for y'all where we could have a abundance of people, say around noon, 12 o'clock high?
Sure, we can get there and set up and be there for a few hours. In the meantime, I believe we sent you the brochures.
This is affirmative. I got them.
Okay. I don't know. I'm sure you have a mailing list. We can pay for the postage if you want to mail them.
I would actually consider doing that. Okay, wait a minute. I think right now the more information you could get out about exactly what's being done, the only thing about them, I've got to go back to Sally to pick them up again, okay, but I'll be glad to go do that, okay, and put them in the mail for you.
All right. Then
and see, that way it's going to give us at least 6 weeks notice, okay, about people being mailed them, okay, and see what the curiosity is. You with me?
Sure. And of course, they can call the office anytime and get information about the programs or sign up for the programs. We can email the forms to them. They can sign them and send them back. We've had people scan them and send them back or mail them back. But because of the COVID spike right now, the office is not open, the office location. We've had to close it because of the outbreak spike as effective today at noon. So you can only call now. We expect to keep this in place for about a week to see where the numbers go. Usually, well, I say usually, last year, it was around September when the numbers started to fall down. So we're gonna wait and see. Again, the reason is because the community health worker in the office is also around a cancer patient. So we don't want to have her exposed. And I'll get with you, Chief Chavis, about mailing those out. The Stay in Your Lane contest, I did get in touch with USC Lancaster about turning over whatever we receive in the art contest. I cannot think of the lady's name right now. I think it's Brittany. She sent me a form. So the artist would have to fill out the form to turn over the material or the artwork to USC Lancaster. And I have that form with me. So as people turn things in, we'll give them the form if they want it turned over to the museum or to the archivist or not. As far as the data, we are wrapping up the first phase of our 2-year grant project. Later this week, we'll be starting to turn information over to Urban Indian Health Institute. We have a data sharing agreement in place with them. So even after this first and second phase, we will still be sharing information. And that information is aggregate information. There's no personal identifying information at all. It's just numbers. And that information is going to be put on their national map. So South Carolina will finally be on the map for Native Americans in South Carolina. And once we have that information available from running the numbers, I'll be able to bring that information to our next meeting in 2 weeks. I do know we've got, I think I was told 180, might be more than that. They gave us their own surveys that we had to get filled out along with our health survey. So it's a lot of data we're crunching down this week. And I'll be able to share that information at the next meeting. Now when Brenton sent the email from Minority Affairs, I'm not sure what happened. It was a simple email, I thought, but it seemed to have ticked some people off. And I was contacted by the Wassamasaw Varnertown Indians and the Etowah Indians. And I just reiterated to both of them that this is a health board and purpose of the health board is to work on the Native American health profile for South Carolina, and that is our only goal here. Several of the tribes keep emailing that they're going to participate in the meetings. I don't know if it's the day and the time or what, but we might think about moving the meeting to a different day, maybe even a different time. What's y'all's thoughts on that?
Well, Chief Chavis, it doesn't really truly matter to me. Okay, just this might be the only one in a lifetime shot we actually get to do this to help our populace. If you need to move the time, the date, just please keep me posted, okay?
And Patricia, what were you going to say?
My suggestion would be to send out an email simply asking them if there would be a better date and time in which it might be good for them to be able to attend. I mean, I feel like attending would be a good way to be able to ask your questions for clarification as to what exactly you're trying to do, or maybe simply sending out an email that states what you're trying to do and then asks the question of, you know, would there be a better date and time for you to be able to attend so that you can ask whatever questions you may have so that we can figure out
I
a
know
way
one
to-
person, I didn't mean to cut you off,
You're
Patricia.
fine.
One person that said they were gonna come to the meeting today is actually on Facebook right now. I'm watching them on Facebook. So they must have forgotten about it. But, yeah, I can send an email out to everyone. I'm just gonna go ahead and set the meeting as usual for 2 weeks, which would be September no, we can't do it on 5th. That's Labor Day. What if we do the September meeting on Wednesday, the 7th? That way it's not on Labor Day
That's fine. That's
at
fine for me.
5:30. We'll just do that, September the 7th at 5:30. So basically where we are right now, as far as the methodology, I was gonna look into the methodology. Uh, The methodology, algorithms and try to figure out which one would be the best one and reach out to the grantor to find out which they preferred. But again, I was sick, so I wasn't able to reach out to them. So what we're gonna do is, since this week is wrapping up the first phase anyway, we'll nail that down this week with them, find out what it is that they want, what methodology do they want us to use. I know, like I said, it's 180, I think, surveys of their surveys that they wanted done that we have. So we've got a good bit of information. I'm just, I'm confused as to how a meeting notice turns into grounds to bicker and argue. But like Chief Chavis said, this is an opportunity that has never come along before. Now that we've got it set up, I don't see how it can be, destroyed at
It
this point.
couldn't be a bad idea.
It's not at all a bad idea.
No.
No, because see, up till now, my thought, okay, it doesn't seem like really and truly we've ever been involved in anything dealing primarily with, quote, indigenous people.
No,
And if I might, yesterday one of the greatest questions asked, okay, by several people, asthma. Is asthma, would it be something, okay, that you'd want to put on a form? I said, I would imagine so.
absolutely, yeah,
Okay,
absolutely.
so, no, I tried to do my best, okay, I really truly didn't try and over ad-lib or either downright lie, okay, because some things I didn't know about, I said, but we're going to try and get them back here, okay, but I asked them, okay, when I found out about the terms, COVID, no,
Mhm.
please stay away. Right now, I've got 3 masks on talking to you on the telephone, okay?
Oh, my goodness. Okay.
Not. Go ahead, I'm lying.
Well, I feel like a good way to maybe make it to where, kind of like what Chief Chavis said, he wasn't certain what all was on the survey. Maybe a good way to counteract that would be to make something on the Pine Hill Indian Health Network that maybe states what the survey is about, instead of it just being the survey link, like has a very brief description as to what the survey is, the purpose of it, what
Mhm.
sort of information it might be collecting, how that information, like you said earlier, is not information that's personally identifiable. It's just numbers at the end of the day, and it's not going to lead back to any one person. So
Right,
maybe doing something like that and attaching the survey again in an email with that brief description and then sending it out to everybody with the statement of, like you've said in every meeting beforehand, everybody's allowed to come that has a chair. Everybody's allowed to attend to ask any questions they might have. If anybody has any questions, to email you or to call you or call the health network. I mean, there's ways around it to make it to where if anybody has any questions, be it a chief or maybe somebody that's a tribal member that maybe has questions that's interested in it, they can find the answers that they need type deal.
right.
I
And I'll double
think
check the website to make sure what is it. I don't even remember what's on the website itself. But I know that we're getting phone calls from all over the Southeast. I also know that the Atlanta Indigenous Peoples Association reached out. They're struggling a little bit, need a little bit of structure, so asked us to come in and help them bring structure to what they're doing. And of course, Pine Hill Health Network is willing to help them do that. Excuse me, our nurse practitioner lives there, so it's easy for us to get information out there through her. And of course, our big players this year was Indigenous First Steps, getting that launched. We've had 4 babies this year so far through Indigenous First Steps. So we're really excited about that program. And of course, that program is unique in that it follows the mom and the baby up to the child's 3rd birthday, which is where Head Start steps in. And we don't separate the mom and the baby, we keep them together. That way mom continues to have people to talk to and things like that. What we've noticed in Indigenous First Steps, excuse me, is the generational stories are not getting passed down, and we're not sure why. If it's just that the makeup of the family unit is somewhat off, or if it's people that just don't have anybody to ask, or they don't feel like they can ask, that's been pretty prevalent. Is people don't seem to have other people to ask about things. Tips and tricks, and of course, grandmothers are always the best to turn to for tips and tricks on how to get a baby to drink the bottle or go to sleep. So we are kind of changing a little bit with Indigenous First Steps to get the grandmothers more involved. And I know that we've run into situations where breastfeeding is just not an option at all for various reasons. So that's another thing that we're looking at, is what is an alternative, especially with the formula shortage that we just had. What is an alternative? The diabetes program and the heart blood pressure monitoring, the self blood pressure monitoring program, we have plenty of blood pressure monitors to distribute out still. That's, we've got the supply, so we're able to meet the demand. We've been doing this one-on-one, and since COVID started spiking, one of our community health workers decided to just start doing the drumming side of the program on Facebook Live. And basically what that is just teaching you how to lower your blood pressure by drumming. And to reiterate, that program, once the person signs up to participate in that program, they're given a hand drum and a blood pressure monitor. And the diabetes prevention program, we've added a new program called Rabbit Replacement Addiction, I think it is, RRA, Rabbit Replacement Anonymous, that's what it is. Rabbit Replacement Anonymous, and that is specifically designed by one of our community health workers to focus on sugar intake. So, and Louis, you may know, or I'm sorry, Chief Chavis, you may know the person running that program is Brenda Bishop.
Yeah.
And she's been very, very successful in it already. And watching that program unfold has been amazing to watch. Of course, everybody attributes diabetes with sugar, but the body turns carbs into sugar. So it's sugar intake and carb intake together. It's just a new way to address preventing diabetes, and of course type 2 diabetes for the most part can be reversed. And Laura just came in.
Go ahead.
Go
Go
ahead,
ahead,
Chief.
I'll come back.
Go ahead, Chief.
Of our culture, also of the African American culture, but even, quote, the Caucasian race, diabetes seems to be one of the most overwhelming things that you could ever imagine. Yet nobody really truly wants to talk about exactly why Granny lost 3 toes on her left foot. You understand?
Yeah,
No, wait a minute. I'm not trying to
you're
be smart or
right.
funny, okay? It's there, okay? And see, like it or not, maybe just because of, quote, sheer poverty, what do these people eat?
Right. Right. And that's
It's got to
exactly,
be white bread. You with
yeah,
me? Rice,
right.
potatoes, okay? Now, I realize, okay, they are food implements, okay? I don't have a problem with that. But yet, on the other side, there's so many things connected to the term diabetes, okay? And the long-term or either residual effects, okay, are just horrible, and it will take you out of here way sooner than you ever wanted to go, huh?
It will. It will.
So go ahead, please. I'll keep quiet.
And Laura just jumped on. Laura is our nurse practitioner at the Health Network. Laura, real quick, I'll just go back over this real quick. The COVID spike around us in the local area has gotten to a point that we have closed the office so that there is no one at the office at all. We're only taking phone calls right now. We're going to try this for about 2 weeks and see where the numbers are with COVID at that point and reopen the office then. We're just waiting to see what this spike is going to do and how long are we going to have to ride this wave. But basically what's happened is we were not able to go yesterday to Chief Chavis's ice cream gathering at Beaver Creek because of the COVID spike. And his turnout was lower than what he expected. In 2 weeks, we'll reevaluate everything and look at reopening the office in person. But right now, everything is virtual or over the telephone. And of course, Chief Chavis and Patricia and Laura, our telephone system is set up that we all get phone calls from the recording. So as soon as someone leaves a voicemail, it is sent to us directly immediately. So we can call them back. So if anybody does call, we'll be able to get back in touch with them. Also, from the website, we've gotten several people that's contacted us through the website forms, and the furthest we've reached out, or I'm sorry, we haven't reached out. The furthest away that someone has contacted us is Virginia. And that was just over last week. Someone from Virginia contacted us. But Laura, real quick, this week we're transitioning from phase 1 to phase 2 with the grantor. Phase 1 is still in effect until October the 1st, which we officially on that day switch over to phase 2. We'll keep running these surveys through the end of October. So when the art contest is called, that will be the end of the 2022 data that we collect. After that, we might change the survey, but we'll pretty much keep the same survey to start collecting information November, December, going into next year, collecting the 2023 data. And again, the surveys that we have, I think 180 or so surveys. We're crunching numbers this week. And I was also explaining to Chief Chavis and to Ms. Gilliard that the email that Minority Affairs sent out, we did get responses to the email. But as we were talking, as you were coming on, the need outweighs the nonsense. So we're moving forward. On that note, I'm going to reach out to Dr. Fenton and get the information I can from him to add to the data that we've already got, so that we can start putting all this together and use the methodology that they want to use to start building the profile that we're going to issue this year. Two things that come to mind that were added to the 2030 healthy people was racism and discrimination. Both of those were added as social determinants of health. I don't think that our survey touches on either racism or discrimination, so we might have to take a look at the survey and work that in. And we need to be specific. I'll go back through the 2030 healthy people to find out what their definition is, how they're collecting information on that. So we can try to style some questions specifically for that. Basically the 2022 data may not have information on racism or discrimination, but I think that information is good for the health profile in the future and is extremely valuable data for minority affairs. I believe in helping them figure out which way to go to bridge some gaps. Not necessarily in the health setting, but that might be somewhere else that trickles over into the healthcare setting. There's also, it was brought to my attention, there was a bill signed by the governor in June. I'm trying to find it again. I forgot the name of it. Okay, it's the Medical Ethics and Diversity Act. And basically, the Medical Ethics and Diversity Act allows primary care physicians, doctors, nurses to refuse non-emergency care if they object to the treatment on moral or religious grounds. So I don't think that anybody has pushed it yet, but I'm interested in us looking at ways that we may have experienced in the past where we have been refused care in a non-emergent setting because of our race or ethnicity or cultural belief, which that information would fall under racism and discrimination. My understanding of the publication of the bill and articles surrounding the bill has really been focused more towards the LGBTQ population. And of course, over the past 2 weeks, an AJ Douglas Bear that lives in Canada, AJ was bullied at a powwow for tattoos and her dance style. She's a jingle dress dancer, and she has become a sensation on Facebook. Dancers across the country are standing with AJ against bullying, but it's an example of what we would expect to see in a healthcare setting where we're judged by our cover and not what's inside the book. We're going to try to get in touch with AJ to have her come on the Teen Talk to talk about the powwow bullying problem that she's encountered. Someone asked me what was this all about because I had posted about it on my Facebook page, and I told him it was about bullying at powwow. And it is something that we experience here. I notice it. It's just the question is, for the purpose of this board, is how does that affect health and health access or health care in itself. So later this week, I'll be in touch with the grantor and getting this aggregate data over to them. And Laura, I also mentioned that the Atlanta Indigenous Peoples Association wanted to work with us to kind of bring some structure into what y'all are doing over there. Can you talk for a minute about Atlanta Indigenous Peoples Association?
Sorry. Yeah. Yeah, and I have not, I know you emailed me back with those questions and I just hadn't had a second to respond yet, but Atlanta Indigenous Peoples Association is a really loosely created, just a community organization of originally students, university students, that kind of found each other in the metro area and said, hey, it's nice to know there's some other Native Americans in Atlanta, since there's no urban center here like there are in so many other locations. So they kind of just started getting together at like coffee shops once a month and, you know, doing group events once in a while. So at this point, you know, it's this fluid group of people that kind of come and go, since there aren't many Native Americans that are native to Atlanta, mostly, you know, out of towners that are transient here, like myself. And, you know, so there's no real strict organization here. It's just, you know, people that get together, whenever we can make it happen and just talk about being native and, you know, what it's like, you know, being around people that get you, since we're all many miles away from our tribal homes. So at this point, the main founders have left the city, gone back to their tribal territories. And the last one just kind of left me the brochures and said, can you keep it going for us? So that's where I've been at, just co-director with someone else who's usually not in Atlanta. And that's really all it is. I don't really have the bandwidth to do much more than, you know, kind of keep an active presence on Facebook. We try to, you know, just kind of be a networking resource for other natives in the area and just be, you know, an emotional support group to hang out together once in a while. But that's really the extent of it.
Okay, and now, you know, this board's purpose is to work on the Native American health profile for South Carolina, but the grant is to provide these programs to whoever, wherever. We're not limited to South Carolina, and the grantor did tell us that they wanted any information we got from other states outside of South Carolina. So definitely, you know, I'll give you a call and we can talk more about that outside of this meeting. But I think we can definitely help with that. And we were talking about the next meeting. As I said, Minority Affairs put out an email last Thursday, I believe it was. And several tribal leaders have contacted me since we started having these meetings in June, saying they're going to send somebody, they're going to do this, they're going to do that. For whatever reason, the email that Minority Affairs sent out through the chief of staff sparked an argument between two tribal entities that has nothing to do with us, and we're going to keep it that way. And we're going to just reassess what the COVID numbers are in 2 weeks to see about getting back out like we were doing before. But for right now, we've grounded everything and everybody. I can't really think of anything else to add. Chief Davis, do you want to add anything?
I sure would for a moment. On my personal thought, whatever y'all do, me included, do not drop the ball. Do not lose sight about the prize.
I appreciate that. I don't think any of us are
Don't
planning on
wait a minute.
dropping
Okay,
this ball.
nobody else has done this for us. Okay, we've been here forever. Like people say, okay, well, you old as dirt, but this is the first time we've ever been solely asked as Native Indigenous people for health information. Okay, I'm 74 and I've never heard of it before. Okay, so just don't drop the ball.
We'll do our best not to. Laura, do you have any final words?
No, just a little, ray of hope as far as the spike goes. And I know we've been having another spike, but the deaths do seem to be, altogether drastically down related to COVID. And even the spike itself is definitely lower than what we've seen so far. I just got through it myself, the third round. So I know it's rough. And we still have to be vigilant, but overall, I feel like, things are getting better, and this is probably the variant that's going to stick around. So again, just general health precautions, and I think it just highlights the importance of overall, healthy lifestyles, and how important that is, since I think we're starting to see more similarities to a really bad flu, and the kind of thing that we'll just see seasonally and that we've seen before at this point.
I agree. I think that I know my experience with COVID. I don't want it again. Thank you. Had my round. Glad to have joined everybody in the COVID circle. I do not want to get that again. I think we're definitely on the right path. We've got the guidance of Minority Affairs. We've got the guidance of the Urban Indian Health Institute. We have epidemiologists to rely on. We've got, Dr. Fenton is the statistician among us. He's the number man, for lack of a better description. I think we'll be fine. These tribes and tribal leaders that want to continue to bicker, they can, as long as they don't do it here. And on that, Patricia, you want to add anything else?
No, ma'am.
Okay, well, we do appreciate what you're doing, Patricia, and everyone at Minority Affairs. We appreciate everything y'all are doing. And Laura, I don't know if I sent you the art contest information. It should be on the Facebook page, but I'll definitely get that to you so you can share that in your
Oh, yeah.
area
Sure.
through the Atlanta Indigenous Peoples Association. I think it's important for these kids to express themselves. It's out there, so we'll see what happens with that. So Laura, we were saying that the next meeting in 2 weeks actually falls on Labor Day, so we're going to move it to Wednesday, September the 7th, at 5 o'clock or 5:30. Is that a good time for you?
Yes.
Wednesdays I can't attend, but and I'm not able to attend every 2 weeks, but I'm gonna try to be in there, whenever possible. But I'm usually working late on Tuesdays, Wednesdays, and Thursdays. But I might be able to, at least I could listen to the recording and then tune in the following month.
Yeah. And, just to kind of explain why we're having meetings every 2 weeks is because we were late getting the board put together. And initially it was the health committee, but it was changed to a board at the request of the other boards across the nation. There aren't that many Native American health boards. So they wanted us to change the name to a board so that all the boards could come together and kind of cross-train each other. So that was why the name change. The reason we're meeting every 2 weeks is because we're so close to the end of the first phase. Once we get this first phase out of the way and get these numbers, somewhat together, we'll probably back off meetings to once a month. I'm hoping that we can do that in October.
Okay, great.
And I know with holidays coming up, potentially another spike. We'll just see. But I'm thinking in October we can back it up to once a month, because I know this is a lot to keep up with. I don't have anything else right now. I know I've got some work to do here. Getting in touch with Dr. Fenton. I can't think of anything else to add right now. Everything is running. Everything's moving. The next meeting is set August or September the 7th. at 5:30. I'm gonna go ahead and put that in my calendar so I don't forget. And with that, I think that this meeting is pretty much over. If anybody wants to make a motion to adjourn,
I'll make the motion.
anyone second?
Second.
Okay, meeting is adjourned. I'm gonna turn the recording off as soon as I figure out how. Okay.